Okay. My name is Dr. Darian Greenhouse, and I was doing a checkup on you from your motorcycle accident and your the aneurysm you had.
Right.
Uh, do you have a history of heart problems in your family?
I'm not real sure about the history of heart problems because I was adopted and I have no maternal history whatsoever.
Okay. When you first learned of your condition, how did you feel about it?
I felt that I needed to change my lifestyle, that I could reduce the blood pressure somewhat by the things that I ate and the cutting out of salt in my diet.
Okay. When after the motorcycle accident, when you came from being under comatose,
Hmm.
um, did you remember anything like from the wreck?
I have no memory whatsoever. I do not remember leaving the home. I do not remember riding the motorcycle. I do not remember the accident. I do not remember for about 5 or 6 days after the accident due to a concussion and a skull fracture.
Um, did you have hypertension before the motorcycle wreck or after?
Yes, I was diagnosed with hypertension at 26.
And you was put on medicine ever since then,
I've been on medication since I was 26 years old, that's correct.
and that's by your family physician.
Yes.
Okay. Let me see. Turned. Okay. When you got the your laboratory reports back about you having the aneurysm, did you how did you feel?
I went to the eye doctor and she suspected that there was something wrong, so she did a CT scan, and that's how the aneurysm was found. And then I went to a neurosurgeon who did another test, and he got to see the size of it, and he advised me that the aneurysm was about to rupture, that I needed to have surgery as soon as possible because it was 4 centimeters and it was in the main artery going to the brain. And I didn't hesitate. I had the surgery as soon as possible, and I stayed in ICU 24 hours, and in another 24 hours I was home.
Okay. Let's see what other questions. Okay. What are your thoughts and feelings about how you are doing as of now?
Right now I think I'm doing very well because all the injuries were on my left side, which affected my ability to walk and move and climb, etc. But I'm able to take things slowly and accomplish what I need to get my daily living skills done.
That's good. Um, let's see. How did you feel when you first learned of your diagnosis about the aneurysm? I mean, yeah.
I was very surprised, but the doctor was great in reassuring me that everything would be okay once I had the surgery, that he could completely remove the aneurysm, he would bypass the main artery and go with a brain clip. With the brain clip, I can never have another MRI done because of the magnets, and I have to be cautious because my skull has never unioned again. I have an opening in my skull.
Okay. So, with you not being able to have another MRI, say like for instance, what if you become ill again and they would just have to do a X-ray or some other medical test on you?
A CT scan, yes. which I've had several checkups with a CT scan to make sure that I don't have another aneurysm.
Okay. Yeah. And have any of your medications changed since then?
Yes, my medications have changed numerous times because I no longer am required to take the high dose of blood pressure medicine that I used to take. My blood pressure has come down, partly because of rest, a very proper diet, some exercise, and most of all, relaxing, taking breaks.
Okay. That's good. I think you're doing considerably well. So I think I'll see you back in about maybe 6 months or so.
Thank you.
You're welcome.